Before we are moving into antihypertensive drugs, we have to know about diuretics. So, classification of diuretics, there are main six kind of diuretics. First is CA, carbonic anhydrase inhibitors. They are acetazolamide and dorzolamide. Also, they all ending with solamide. Thiazides, there are chlorothiazides, hydrochlorothiazides, and dopamine. So thiazides ending with thiazides, chlorothiazides and hydrochlorothiazides mainly, and the loops furosemide, torsemide, ethacrenic acid, potassium sparings. There's spironolactone, amiloride, and trimetherine. Osmotic diuretics. There's mannitol and glycerol, and there's also ADH antagonists, conivaptone and tolvaptan. When you're talking about thiazides mainly used in hypertension. And when you are giving thiazides for hypertension, you have to know they are contraindicated in diabetes mellitus because the inhibition of insulin secretion from beta cells of pilot of Langerhans in the pancreas and inhibition of peripheral utilization of the glucose due to decreased secretion of insulin and decreased utilization or the inhibition of utilization of peripheral glucose. Those two things will contribute to increase the glucose into the blood, so hyperglycemia occur. So that's why thiazides are contraindicated in diabetes mellitus. Two main reasons. And thiazides are indicated in diabetes insipidus. Diabetes insipidus, this is a special condition. This is not related with the insulin or the glucose. This is mainly due to increased ADH, antidiuretic hormone, um, and they are indicated in diabetes insipidus. This has nothing to do with glucose. So, because why they are indicated? Because the loss of sodium and the due to hyponatremia, ADH also will be decreased and thirst will be reduced. So, diabetes insipidus main symptom is polyuria. Polyuria. This is not due to hypoglycemia, but it's due to endocrine disease mainly. It's diabetes mellitus is also in endocrine disease, of course, but this is nothing to do with glucose. And increased potassium accretion will cause hypokalemia. So you just have to know thiazides are contraindicated in diabetes mellitus, but they are indicated in diabetes insipidus. All right, diabetes insipidus. So we will talk diabetes insipidus in next coming videos, but mainly you just have to know in these diuretics in this video, these thiazides are contraindicated in diabetes mellitus. These are two main reasons: inhibition of insulin secretion from beta cells of islets of Langerhans and inhibition peripheral utilization of glucose. And adverse effects of thiazides and loops, there is hypokalemia, hyperuricemia, hypercalcemia in thiazides, hypocalcemia in loops. How do you remember that loops cause hypocalcemia? Because loops, double o, there's hypo, there's a o, so hypocalcemia, it's causing loops, right? Hypercalcemia is due to thiazides. In hyperglycemia, hyperlipidemia, and hypomagnesemia. So, adverse effects of diuretics are is the most common question that you would get. It's you have to remember hypokalemia, hyperuricemia, hypercalcemia in thiazide, hypocalcemia in loops, and hyperglycemia, hyperlipidemia, hypomagnesemia. Why hyperglycemia? We talked about good thiazides. They inhibit secretion of insulin beta cells from islet of Langerhans in pancreas, and also they inhibit utilization of glucose in peripheral tissues. And also there's metabolic acidosis and metabolic alkalosis. Due to bicarbonate excretion increasement, metabolic acidosis will be caused by carbonic anhydrase inhibitors, because carbonic anhydrase inhibitors they will cause bicarbonate excretion more, and H plus will be accumulated in the blood, and H plus is neutralized by bicarbonate. So no bicarbonate means H plus will be increased, so acidosis will be occur. And potassium sparings also, uh, potassium sparings also causes metabolic acidosis, and metabolic alkalosis is caused by loops and thiazides. loops and thiazide. So if someone asks what drug is causing what diuretics causing metabolic acidosis, you could say it's carbonic anhydrase inhibitors and potassium sparings. And why carbonic anhydrase? Because they increase bicarbonate excretion. When bicarbonates are excreted, they increase H plus ions can't be neutralized because according to our buffer system, they need bicarbonate, no? Bicarbonate. So without bicarbonate, you cannot neutralize. So H plus increase, metabolic acidosis will occur. So when you talk about diuretics, you have to know what is the classification. Main is thiazides and loops. Thiazides mainly used in hypertension and they are contraindicated in diabetes mellitus. They indicated in diabetes insipidus. What are the side effects? Hypokalemia, hyperuricemia, hypercalcemia by thiazides, hypocalcemia by loops, hyperglycemia, hypolipidemia, hypomagnesemia, and also metabolic acidosis and metabolic alkalosis. Metabolic acidosis is by CAC, carbonic anhydrase and potassium sparings. And metabolic alkalosis, we know loops and thiazides. What is the common side effect of loops and thiazides? Someone asks, it is metabolic alkalosis, loops and thiazides.